Back on the Morning Brew with friends with Dr. Michael Pendleton, the future president of Southwest Brain Centers. Good to have you. And you are on the cutting edge of something that sounds really interesting. I know that the movie Concussion just came out with Will Smith in it, and there's been a lot of talk about concussions in football, but it also affects kind of the rest of us in our daily lives too, right?
It sure does.
And so tell us what it is you're doing, because you're a chiropractor.
Correct.
And I generally think of chiropractors as working on the back, not the brain.
You're correct. But the back or the spine is completely connected to the brain. Spinal cord, brain's their central nervous system. But we're doing more things than just simply manipulation or chiropractic adjustments. We are using or been trained to look at the brain and look at the visual system or the oculomotor system, the way the eyes move, and the vestibular system.
The vestibular system. I don't know what that is, but it sounds complicated.
The vestibular system, many syllables, but it's your balance system.
Oh, of course.
And so what we balance with, that's our inner ear. And our inner ear, the way it fires to our brainstem and then to certain parts of the brain, primarily called the cerebellum.
Okay. And so how do you integrate that into your chiropractic practice?
Well, what we do is we'll see patients or new patients that have come in with a neurological complaint. The most common thing with a head injury or a concussion, people will feel like they can't concentrate. A lot of times they'll feel off balance. They'll feel like sometimes the world is moving on them. They'll have kind of like they're feeling in their fog. They'll have headaches. They'll be very fatigued, tired. So what you do is
that happens to me after some tequila.
Yeah, me too. But from there, you take all that information and you can kind of come into what we call the level of their lesion. And where it is where possibly their problem is at.
Okay.
So if you can be more specific where we think the problem might be at say it's the right frontal lobe or it's the left cerebellum, or we can go, even to what nuclei of the cerebellum, which is like what specific part, is it in the top part of the brainstem, the middle, the lower, and what you do is you take the person's history and their complaints, and then you do an examination of a full physical examination, neurological examination. We do a computerized test on somebody's vision called a sacodometer.
Is that the one that follows your eye path?
It's close. It follows fast eye movements.
Okay.
So, but it's set into a certain pattern, but you can look at a person's reaction time, which the research shows we all have a certain speed that we react to. And if it's slower than that, we know there's probably a delay in the processing, usually coming from the frontal lobes. So we look at things, our brain says, oh, I want to look at that just moved, or I want to look at this. You're looking at me, eye, nose, all over the place. Those are fast eye movements. Well, they can be inaccurate, they can be slow, they can be overshoot a spot, undershoot a spot. So we look at that, and then we also finally do a really good test with somebody with their balance. And we do that on a computer on a force plate.
Okay.
And we do that with them standing on a hard plate, eyes open, eyes closed, and we put a piece of foam on there, and the foam basically takes away proprioception. So that's another big word, which is just when we stand, we get information from our lower body.
Of course.
Muscles, tendon, legs, skin. So we take that away, and what you can do, you can really go into somebody's vestibular system and see, hey, is it more of a right problem? Is it left? Is it when they look down, when they look back? And I can literally go into which canal of their ear or which part of the inner ear could be injured, and then you can treat it specifically with non-pharmacological and non-surgical procedures.
So does this have to be like a recent concussion, or is this something like years ago I was in an accident, hit my head pretty good? Does that still affect me today?
Sure does.
Okay.
Yeah, I remember at the seminar, our first one, and there was probably about 500 doctors, and the presenter, the doctor who we learned this from, Dr. Carrick, said, so everybody raise your hands who's had a concussion in here.
Right, everyone.
90% of everybody we all have had concussions.
Right.
I've had plenty. I played rugby. I mountain bike here in New Mexico. I've gone on the handlebars.
Right.
Skied. So what happens is you can have a concussion. You have a good, young, healthy brain, but then you drink tequila over the years, and we smoke. We don't eat right, medications. We don't take care of ourselves. So you can see our health decline. And the brain
health
declines. Right.
Yeah.
Good example, I had a young lady. She's 48. She's younger than me. She's a nurse here, I believe at Presbyterian. She had a severe car accident on Pennsylvania and Candelaria, or Comanche.
A long time ago or recently?
She was 21 years old. Sat in the middle seat of a little pickup truck, hit by a guy who had a seizure or passed out, had a heart attack, hit them going 80. she went through the back of the truck.
So she got a pretty major brain injury.
She was unconscious.
And that was, so is that the kind of thing that throughout her life she will have to deal with the repercussions from that?
She did not start to deal with them or develop symptoms till just about the last year or two. And the same thing we talked about earlier, lack of concentration, lack of focus, short-term memory loss, things like that. So we did an exam on her. She has mild problems, cognitive issues, and we're going to start treating her here in about a week or two.
And what is that, what's the prognosis for treatment like that? Does somebody get better, somebody get worse? Do you maintain your brain function? What happens?
Again, a great question. It depends on the person.
Okay.
You know, if I have somebody who's a teenager and they're young and they haven't, you know, polluted their lives and they've had one little head injury, they can recover. A lot of times they don't even need us. Their brain recovers. But it's when you have multiple, especially I have young girls, soccer players, one girl's had 6 concussions, one's had 9 concussions.
Wow.
And one's 19 and one's 21.
Wow.
And so you can always start with an old person or a young person. It doesn't matter.
Yeah.
But each person is their own entity. So I can't say, oh, it's going to take me 5 days or it's going to take me a year.
Yeah.
You just kind of got to see how they respond to treatment.
Yeah. Well, great. There's a little way you were telling me earlier we can kind of figure all of this out. So we're going to set this up here and see if we can figure out what happened to me and see if I still have 20 years later issues from my concussion.
Exactly.
All right. Let's see here. So you're telling me it's kind of a balance test, right? So just stand here.
Sure. So this is what we call a mild field sobriety test, what the police would do to us. So when we've had too much to drink, that affects the cerebellum, the back part of the brain that deals with balance.
Okay.
So in concussions, a lot of times we'll see those injuries in that part of the brain. So
Okay.
in my office, we'll do a quick little vestibular test.
And this is one where normally you put somebody on foam, right?
Well, this one we do before we put them on the phone. So we do this one, what we call bedside.
Okay.
So we'll do it with you. So what I'm going to have you do, Dan, is put your feet together like this.
Okay.
All the way. No cheating. Okay, arms down by your side. And I want you to close your eyes.
I'm already falling over.
Yeah. So we all sway a little bit. Keep your eyes closed. No cheating. So I see a little something there, a little sway to your right. So now put your arms out like Frankenstein in front. Now eyes closed. Okay, now I want you to touch the tip of your nose. Oh, you've done this before.
I'm an old pro. I can do the alphabet backwards, too.
Left hand. Do the right finger again. Okay, now wait. Left pinky. Right pinky. Okay, left thumb. Right thumb. Okay, slow it down a little bit. Just do your left thumb. There you go, right thumb. Excellent. Hands down. Okay, eyes open. Now hands like this. And just turn them back and forth like this as fast as they'll go.
Like this?
Oh, yep. Supinate, pronate. Keep going, keep going. Okay, good. Stop.
Do I have some issues? Am I okay?
You have little mild ones.
Okay.
Nothing bad. One more test.
Okay.
Okay, I want you to stand now on your right leg and bring your left knee up like this. Hold it there for about 10 seconds. Very good. Switch.
I guess I'm okay.
You're actually really good.
Okay.
You're a pretty healthy guy.
Awesome.
Right. A few things I saw, but nothing that we need to go into detail with.
Okay,
Yeah.
but nothing I need to worry about, even though I did have an injury years
Now,
ago.
this is one part of the issue, or part of the examination. So we need to look at other things too.
Right.
So
Is
right
this the
now,
kind of thing that, like, if somebody is, at what point would you know that it's serious? If I started falling over?
exactly. Or if you were doing this one and this hand is like, searching, and this hand comes in here. It's usually we see those. It's pretty obvious. Yours, I saw a couple little misses. You're going fast. A lot of times it's easy to go fast. You go slow it down, and you can see sometimes more of a problem.
And these are the kinds of things that you can find treatments for, help people with.
Usually we can treat them that day, and hopefully the treatment will make a change, which is diagnostic. And then we know, hey, there's a window of opportunity here that we can help you.
Sounds like a plan.
Yeah.
We'll be back in a couple of seconds on the Morning Brew with friends. Thanks. We're going to sit here and practice the alphabet backwards and do some of this stuff.